problem in infertility. A common problem in infertile women is called endometriosis or chocolate cysts. I know it's quite a mouthful, but if you want to find out more about what you can do to treat this distressing problem in infertile couples, watch the entire video and I'll provide you with a solution. Endometriosis is a bit of a mouthful. I completely agree with that. People misspell it all the time, mispronounce it, and I'm not trying to make you a medical expert here, but you should know what you have if that is in fact your diagnosis. And the good news is there's lots of information available about endometriosis on our website, which is www.drmalpani.com. The information is free, so check it out. So what does endometriosis mean? It's a bit of a puzzle, this disease. It's an enigma wrapped in a mystery. We don't know who gets it. We don't know why they get it. We don't know what makes it worse, what makes it better. But we do know that it's common in infertile couples. So sometimes it's a bit of a chicken and egg problem. Is the endometriosis causing the infertility, or is the infertility making the endometriosis worse? We don't even know something so basic as that. And we don't know what causes it. We do know that what endometriosis means is that the inner lining of the uterus, what's called the endometrium, endo is inside, metrium refers to the uterus. So the inner lining of the uterus is no longer found just within the uterus, which is where it's supposed to be, but it's then found outside the uterus where it's not supposed to be, and that's called endometriosis. So as you can imagine, these lesions of endometriosis could be all over the pelvis. They could be the ovaries, they could be just outside the tubes, they could be spread all over the pelvis and the bladder, bowel, all kinds of things. And we don't know why it occurs. We don't know what makes it worse. We don't know why some women have large endometriotic cysts and no symptoms, and why some people have minimal endometriosis but lots of symptoms. So your next question is, what are the symptoms? Again, varies. Some people have no pain at all. Some people have very painful periods which get progressively worse with time, what's called secondary progressive dysmenorrhea. Dysmenorrhea is pain during periods. But again, lots of women who have severe endometriosis will have no dysmenorrhea at all, and on the other hand, women with mild endometriosis will have severe dysmenorrhea. The correlation is not very clear or obvious. And some of these women will also have dyspareunia or pain during intercourse, especially during deep thrusting, and it can sometimes be picked up on a clinical examination. Often it's a difficult diagnosis to make because the gold standard is really doing a laparoscopy. Now that's an invasive procedure where a doctor actually puts a telescope inside your pelvis to see if you have endometriosis or not, and it's expensive, so obviously that's not something which we do too often. The other way the diagnosis is commonly made is when the doctor does a vaginal ultrasound scan to look at your ovaries, and then he finds a cyst. And chocolate cysts have a fairly classical appearance. I know the word chocolate doesn't sound very appropriate for something like this, but a lot of these cysts contain old, dark, tarry blood, which looks like melted chocolate. And that's why they call chocolate cysts, and this is often seen in infertile women. Now, you must understand, just because you have a chocolate cyst, that doesn't mean that's the reason for your infertility. But the problem with chocolate cysts is as they continue to increase in size, this eats away into normal ovarian reserve. So lots of women with chocolate cysts will have poor egg quality, will have a poor ovarian response, and this will affect the chance of getting pregnant. So that you should ask the doctor to check what is called your AMH level. That's a blood test to check your egg quality, ovarian reserve, and also to do an antral follicle count to see how many antral follicles or normal follicles you have in your ovary, which will give you some idea about what your fertility is. If you do have a chocolate cyst, please don't let the doctor do surgery and remove it. Doctors are very good at scaring patients. Oh, you have a chocolate cyst, and oh, it may rupture. It's not a time bomb. It's not going to go off. You know, if you hadn't done the scan, you wouldn't even have known you have a chocolate cyst. Small chocolate cysts are very, very common, and in fact, very hard to differentiate a chocolate cyst, which is 2 centimeters in size, from a corpus luteum cyst, which is physiological. And even if there is a cyst, you don't need to do anything. You can just observe it. And if it is increasing in size, not a good idea to do surgery, because when the doctor removes the cyst, they often remove normal ovarian tissue with it, which means your ovarian reserve declines even further. And that actually means that the surgery makes you more infertile than you were, which is, you know, making a bad problem worse. So if the cyst is not bothering you, leave it alone. If the cyst is bothering you, then we can puncture it with vaginal ultrasound guidance. That's called a transvaginal aspiration. Simple procedure, good doctors do it very easily, it's very safe, done under general anesthesia, under antibiotic cover, so there's no risk. But lots of doctors don't even know how to do this procedure. Of course, the problem with the cyst aspiration is we're not treating the underlying problem, and the cyst can recur, it may come back. But you know what, that's true even if you do surgery to remove the cyst. We can't stop new cysts from recurring. And if at some point your priority is to have a baby, then often the best thing is to take a shortcut and to do IVF, because then you're bypassing all these problems and getting pregnant. And the great thing about doing IVF with chocolate cysts is it maximizes your chance of getting pregnant. And when you do get pregnant, this often treats the endometriosis, because for 9 months there's no further menstruation, so the endometriotic lesions will often get suppressed, and that's true even when you're breastfeeding. So the beauty about IVF is it gives you the baby and treats the endometriosis as well. Have questions? Feel free to email me. Our website, as I said before, is www.drmalpani.com. I'm an IVF specialist, happy to offer a free second opinion, no strings attached, and if I can help you to have a baby, I'll be extremely happy to do so. Look forward to seeing you.